Michelle, you're good to go whenever you're ready.
I'm sorry, I couldn't hear you.
You're good to start whenever you're ready.
Oh, we do have quorum?
Yep.
Oh, I thought you said no. I was waiting. Good thing you said that. I was waiting.
We just had a couple more people join, so
Okay.
you're good to go now.
All right, thank you. Good morning. It's 9:32. Welcome to the Maricopa Regional Continuum of Care Committee meeting. For all participants, please mute your phone or computer when not speaking, and please do not put your phone on hold. For all participants, we ask that you please identify yourself when speaking, and we will be reminding people to do that throughout the meeting. So we will go to the call of the audience. Please note that members of the public were given an opportunity to submit written comments relating to this meeting to azmag.gov/comment within 1 hour of the posted start time for the meeting. Additionally, we invite anyone wanting to attend the meeting to request the Zoom link from staff or to fill out the registration form for the Zoom link at the MAG meeting event page. The public may attend the meeting and offer comments after committee discussion on each agenda item using the raise hand function in Zoom. So MAG staff, were there any comments received or anyone who has joined the call to offer comments?
Madam Chair, there were no comments received, and we've had people attend but have not raised their hand at this time. Okay,
thank you. So we will move on to the next agenda item, which is the approval of the October 13th, 2021 meeting minutes. Does any member of the committee have questions or comments on the meeting minutes? Okay. Could I have a motion to approve the October 13, 2021 Maricopa Regional Continuum of Care Committee meeting minutes? That was a mouthful. So could I have a motion?
I motion.
Okay.
This is Saracen.
Okay, thank you. Sorry, I couldn't get the panelists, so thank you. And then could we have a second?
Richard Cruz, second.
Okay, Richard Cruz. Okay, so now I will ask Katie to proceed with the roll call vote. Please indicate clearly on how you vote, saying yay or nay after your name is called. Katie?
I need to unmute myself. Vanessa Cartel.
Yay.
Erin Cohen-Hyde. Richard Cruz.
Yay.
Kathy Dinolfi.
I have to abstain. I wasn't present.
DC Ernst.
Ditto what Kathy said.
Michelle Jamison.
Yay.
Wendy Johnson. Anne Marie Johnston.
Yeah, I did not hear the first comment. I had technical difficulties joining, so.
We are voting for the roll call of the approval of the minutes for October 13th.
Yay.
Christina Lopez, who is taking Didi Gazi's seat for NEC. Laura Magruder.
Yay.
Jennifer Page.
Yay.
Nikki Ramirez.
Yay.
Tyler Rosensteel.
Yes.
Shayla Schuster. Sarah Sims.
Yay.
Lynn Spillers, who is taking Erin Rain's seat for the city of Mesa.
Yay.
Craig Tripp again.
Yes.
Did I miss anyone? All right, the motion passes. Back to you, Chair.
Thank you. So we'll.
Letitia Brown Gambino, yay.
Thank you, Letitia. Thank you. So we'll move on to the next agenda item. But real quick, Katie, is anybody else having a difficult time hearing Katie, or is it on my end? Must just be on my end then. So you're good, Katie. Okay, so moving forward, we will be moving the updates to the beginning of the meeting. An update will be provided on legislative issues of interest in the Maricopa Regional Continuum of Care Board, and subcommittee members will provide an update on recent activity. This item was requested as an ongoing agenda item by the COC committee to remain informed about the work taking place legislatively and in various committees. We will hear from the Coordinated Entry Subcommittee Chair, Matthew Kelly, Lead Housing Liaison with Mercy Care. Matthew?
Hi there. I wasn't totally prepared for this, but I just have a couple of quick updates. I think one of the things that I'm not sure if I've told the committee this, but I've told the board this. The coordinated entry subcommittee is finally, at this point in time, completely full. We have 13 members of the coordinated entry subcommittee, so we're happy to have that. Some of the things that we're working on right now, we're going to be presenting on today, which is talking about the integration of homeless prevention into the coordinated entry system, and I'll talk about that in a minute. Otherwise, one of the other big things that we have been working on is there is an RFP that's going to be going out very shortly for an evaluation of the coordinated entry system. The subcommittee has met and kind of reviewed the initial scope of work for that evaluation and added some additional things in an effort to, I think, enhance the evaluation and kind of beef up that scope of work as the RFP does go out to contractors for review and bid. The exciting thing about this particular RFP is not only do I think we have enough money in place to go ahead and do an evaluation of the coordinated entry system, which could be, I think, probably a little bit more enhanced from what we've done in the past based on what I've seen. But in addition to that, we also have additional funding that would allow for the implementation of some improvements and enhancements to the coordinated entry system as part of that process. So I think it's a pretty exciting opportunity, and we're kind of just in the beginning phases of seeing that go through.
Great. Thank you, Matthew. You did a great job for not being prepared.
Yeah. Thank you.
Next, we will hear from TJ Reed, Maricopa Association of Governments, to provide a brief update on the data subcommittee. TJ?
Good morning, everyone, Madam Chair and members of the committee. So the primary update that we wanted to share with you all today is related to HMIS, and that we are soliciting the data subcommittee reviewed a proposal from HMIS team as well as MAG and others to really look at evaluating the current system that the HMIS team and our community is using, which is a WellSky product or Service Point, which many of you may be already using plenty of. And so the idea here is that we have identified several issues with the system, and we have interested funders involved in this who would be willing to support an evaluation of the current system, and then taking that evaluation to look at what we can do, whether that is negotiate with our current vendor, shift vendors, look at ways in which we can really enhance the way that data is gathered and utilized in our community to better our efforts in ending and reducing homelessness here. So that did go through the data subcommittee that was fully reviewed, and we're passing that all the way up through the committee and the board. You will be able to get a chance to see that in more detail as we send that out and walk through it in the next committee meeting. That is the primary update we have for the data subcommittee. So back to you, Madam Chair.
Thank you. Okay, so does any member have any, any community member have any comments on this, any items discussed? Oh, okay, Joan? Oh, Joan, yes, did you want to give an update as well?
Yeah, well, that's it. Did you want me to give an update? Is really more the question.
Yes, please do.
Okay. So this is just actually an update. You know, we are in November, gearing up for the legislative session. There's, as you might have seen, there's been about 11 different people who have resigned their office at the state legislature. So this is going to be an interesting session. So that, you know, that presents an interesting situation where a lot of appointees will take over those folks who have resigned. It's also an election year. I think I mentioned that, but so it's going to be an interesting session to say the least. However, that being said, the Housing Coalition has a couple legislative priorities that we'd love to share with you all real quick. You know, very similar to previous years, we're going to go back and ask for an annual appropriation for the State Housing Trust Fund. We used to say we're going to restore the Housing Trust Fund, but that took a lot of backstory. So just, you know, the state needs to invest an annual ongoing appropriation. And, you know, if we wanted it to be back the way it used to be, that annual appropriation would be about $10 million. So, and if for those folks who may not be familiar with the Housing Trust Fund, it's administered by the Department of Housing, and it's a really flexible fund. Most of it, you know, meets the needs of folks in crisis, and it's more for bricks and mortar, but it can be used for service delivery. But again, it's more for bricks and sticks. So that's something that, you know, knowing that the Department of Housing, you know, we've got a great leadership over there. We appreciate them, you know, administering those funds. Just the caveat there is that, you know, there is still a lot of influx of federal COVID-19 dollars. So that case might be hard to make with lawmakers. The other legislative priority that we are going to be pushing for at the state capitol is recommissioning the old Arizona Commission on Housing and Homelessness, basically a state interagency on housing and homelessness, very similar to the US ICH. So this is actually something that's happening rather organically, being led by Director Simplot at the Housing Department. But we would like to see all state agency directors that, you know, and if you think they may or may not have a hand in homelessness, the reality is that we know they do. ADE, DVS, DES, ADOH, all these different state agencies, Access, obviously have a hand and role in addressing homelessness and housing insecurity. The reason why we're pushing forward with that is because obviously with this COVID-19 dollars, we would have loved to see a little bit more strategy going into this. We know that Director Simplot is working with groups like MAG and other continuums of cares to try and get to try and get all the strategic plans and annual reports kind of rolled up into more of a state comprehensive plan. And so then there's an opportunity to be more strategic and figure out what those gaps are. So those are our two legislative priorities at this moment. You know, we're going to be most likely playing some defense and looking at you know, other needs of our members and supporting some of our members' asks of the state legislature. I'm going to pause and see if anybody has any questions. I can give a brief update on federal, but there's not a lot of traction there. So I'll pause and see if anybody has any questions or comments. Okay, hearing none. Oh,
Wendy has one.
Hi, Wendy.
Hi, I moved to a new office and a new computer, so I'm a little weird right now. But I just have a question, Joan. Will this parallel organically developed committee be looking at all the initiatives that are underway in municipalities and then like the MAG initiative to create some pressure maybe on some of the municipalities?
That definitely would be a goal. I don't anticipate that happening right overnight. I think the reality is that we, you know, let's say we get this commission passed by, let's say, June of 2022. That strategic effort probably won't really take place till 2023, because I think there needs to be kind of a level setting for this commission, because I do believe it's going to be made up not only of state agency directors, but I think we need to obviously have voices of folks that, you know, with lived expertise at that table. We need to have local level policymakers informing that, and then state legislators as well informing that commission. So I think there's going to be probably about a 6 month, if not longer, 6 month level setting and ramp up. But then I do think, you know, how can we work with our cities and towns to, you know, combat some anti-NIMBYism and make some zoning and zoning changes, basically. So yes, but it's going to take a bit.
Thank you. That answered my question.
Mm-hmm.
Anybody else? Sorry, any other questions for Joan?
Do you want me to give an update on federal stuff? Just brief.
Yep.
Okay. So, you know, obviously all eyes are on what's happening with the Build Back Better plan. Obviously, we had the infrastructure legislation passed. That infrastructure package did not have a lot of the affordable housing investments that we were hoping for. And instead, it's going to be part of that Build Back Better budget reconciliation plan. So we still are putting pressure on our congressional members to support that. If anybody's got a crystal ball and can figure that one out, God bless them. But we are pretty encouraged by, the Senate had the last kind of toil at the budget and passed it off to the House. The House made some changes where they would actually include something that you all were pretty loud and vocal advocates for, which was a couple of years ago, the Affordable Housing Credit Improvement Act, which strengthens the federal low-income housing tax credit program. So the House actually added that to the Build Back Better plan. So we were pretty excited about that, because so not only is there going to be some significant affordable housing investments, but again, that federal LIHTC program, which is so crucial to not only Arizona, but the nation, if it passes, then that's going to be quite helpful, because we need more units. So just visit our website if you want to talk to your congressional members. There's a call to action where you can send letters.
Okay, thank you. Does anybody have any comments or feedback? Okay, thank you, Joan. We'll move on to the next agenda item, which is the homeless prevention work group update. So Matthew will provide an update on the homelessness prevention work group and the policies and procedures developed. Matthew?
Hi, everybody. So I'll just start by try and give a quick update. So first and foremost, I wanted to kind of mention this has been a collaboration with a bunch of different partners within the community. So it's included both of the coordinated entry leads, Solari, DES, most definitely, MAG staff, and then also all of the homeless prevention providers as far as pulling this all together. So I want to thank everybody for taking the time. I know this has been kind of a process. I think we've been working on this now for 3 or maybe 4 months. So now what I'm here to kind of do is just talk through how we're going to be integrating specifically, and I want to be clear, just because I think homeless prevention can be referred to a lot of things. It's the ESG HP homeless prevention dollars that are being integrated into the coordinated entry system. So this is the DES funding that's being integrated into coordinated entry. Prior to this integration process, there were, I believe, 5 different providers within our community that were receiving the homeless prevention funding. And each one of those providers historically received typically what was a pretty small amount. With the Coronavirus Act, there was a significant increase in the homeless prevention dollars. And as part of that also, there was a request to integrate that into the coordinated entry system, which is in response to what we're doing here today. So as part of that, the homeless prevention providers previously were kind of using the HP dollars for the members that they were serving through some of their other programs, whether it be rapid rehousing or other various programs as they were coming in their front doors. What we're trying to do is evaluate this or use this and make this a little bit more accessible to the broader community by integrating into coordinated entry. So what we have done at this point in time is kind of the first phase of integrating this into coordinated entry is we are looking to make our homeless prevention providers, the company or the organizations that receive funding, the more or less and I'm going to say in air quotes, the access points for the HP funding at this point in time. So they'll continue to present at those particular providers for those funds. But instead of just more or less being on a first come, first serve basis, what we have done is we've actually created an evaluation tool and a prioritization tool. Now I'm going to go ahead and share my screen and quickly run through this and kind of give you a quick rundown of how this looks and works. Now, if there are questions as I kind of go through this, please feel free to ask questions. I know that there might be some as we progress through this. Now, this particular tool was created in coordination with DES, the homeless prevention providers, and also MAG staff. and the leads. And then we went ahead and we did forward this back on to the racial equity partners for a review of this document. In the creation of a tool, I think we were all very cautious or trying to be aware of the fact that we don't want to create another tool that's going to create some racial inequities within our overall system. And so we wanted to run it by racial equity partners. They gave us a ton of feedback with regards to that. In response to that, we did remove some questions and also enhance some of our other questions. Some of the questions that I kind of wanted to point out where I think we're trying to address racial equity were specifically number one, if you're in danger of losing your housing or have received a notice to vacate. One of the additional things that we went ahead and add to this was added the basically the top eviction zip codes in Maricopa County as a means of really trying to focus in on our populations that are maybe kind of overlooked and served. So individuals living in those zip codes are actually going to receive an additional point with regards to that. We did also, I think one question that we removed, we were told by racial equity partners that typically asking about disability status typically tends to prioritize Caucasian males. So we went ahead and asked ourselves, do we really need that question in this questionnaire? And the answer was no. So we went ahead and did remove that question from this tool as well. The rest of the changes I think were pretty minor with regards to this. I'm not sure if anybody else from MAG has any areas that we specifically talked through. I think we kind of looked through a number of different areas with regards to the decrease in income, and then or also increase in non-discretionary expenses. We talked about doing one or the other. We talked about, we decided to do both in that instance. And I think those are the other things. And we also kind of really tried to focus on families by including some questions with regards to not only Department of Child Safety involvement, but in addition to that, also asking if the individual is a single parent with a minor children as well. We kind of went back and forth on doing one or the other and decided we wanted to try and focus on making sure that both questions were being asked. Now, I'm going to go ahead and forward this tool out to the entire group for review. Since we were not able to get this out to you in your packet as part of the meeting, I wanted to at least provide an opportunity for the group to review. So I'm going to ask if you have the opportunity, I'm going to send out this and then also the process document with regards to the homeless prevention services and allow for people to review it and provide feedback. I'm open to any of that at this point in time. It's not completely finalized. So we're happy to make some minor adjustments and we can go ahead and do that. The other thing with regards to utilizing this tool is an effort to do this rather than doing a first come, first serve and the funds running out very quickly. What we're going to be doing is evaluating the available funds and the need within the community and determining the threshold for individuals qualifying for the homeless prevention resource on a 60-day basis is what we're going to be looking at. So every 60 days, we'll meet with the coordinated entry leads and also the subcommittee and just review available funding and also the need and make adjustments accordingly. So this is going to be a new process, so we don't know exactly where we're going to start on this. And I think we'll make a guess. We'll start a little bit higher on the spectrum and then kind of see where things go from there and lower the threshold as we kind of determine what the need is going to be. It's an effort to continue to have these resources available throughout the year rather than be gone within a very, very short period of time. Now, one of the things that we did kind of talk about, and I think in a real ideal world, what we're going to be doing is we're going to be running this through coordinated entry. So these applications will be submitted through coordinated entry and basically bounce to the coordinated entry leads. But the idea is, in most cases, what we're anticipating is that the HP providers that are completing the applications and submitting to them to coordinated entry are going to be able to turn around and serve those individuals immediately. So we're not necessarily going to be creating a major delay in access to those services, but it was a way to continue to run it through the coordinated entry system as a first step. I think that we'll want to consider in the future a full integration into coordinated entry, but to meet the contractual and the federal requirements for this, we wanted to go ahead and get it up and running and moving at this point in time. Those are the basics of the process at this point in time. Are there any questions? I know this is a lot. And I think what's important to also know is this is not necessarily up for approval from the committee because this is technically DES funding. So while it's integrated into the coordinated entry system, it doesn't necessarily require the committee and board approval to go ahead and complete the integration of this. But if there's any questions, we wanted to get feedback from the community because the committee obviously has representatives from a large portion of our community.
Matthew, this is Letitia from UMOM.
Hi.
What is the timeline for this to be implemented?
Good question. Thank you for doing that. That's actually was on my agenda of stuff to say. So we're looking at doing 2 trainings right now. So we're going to be scheduling trainings with the HP providers, and we're going to be really focusing on making sure that it's the boots on the ground who are going to be attending that training for December 7th and December 9th. I've picked out dates and times with MAG staff and also in coordination with DES. And then we are looking at a go live date of December 20th.
Thank you. Is there any other questions for Matthew? All right, thank you. Thanks, Matthew. We will move on to the next agenda item, which is the regional strategies. So TJ will provide an update on the regional action plan, next steps, and the committee's role in the action plan. TJ?
Thanks, Madam Chair and members of the committee. I just wanted to let you all know kind of a brief verbal update of where we're at, and that this document with much of your feedback and support is available for you to review. Katie has it up on the screen now, and I believe it's attached as a document on our website. So if you're wanting to review it further, I mainly wanted to just share where we're at in the timeline. So we've been presenting each month at this group as well as the board. We also did a few provider focus groups and have solicited feedback in individual sessions outside of that as well. So the first thing I just wanted to share is thank you all for your feedback thus far in this. It has been a long time coming. So this month, MAG is presenting this for action at a few different entities. So one would be the MAG Management Committee, which is made up of a lot of city managers, town managers, et cetera, which happened yesterday. They all voted to approve this and accept this. This is then going to our Maricopa Regional Continuum of Care Board meeting at the end of this month for action as well. And then in early December, it's actually going to Regional Council with all of the mayors and leads of each of our member agencies to vote on. And so we're really excited for that to happen and to move forward on many of these things. So I'm not going to get into the detail because you all are probably sick of hearing it from me, but you have the document if you're wanting to go through those details. And just know that I and our team at MAG are more than willing to answer any questions or take some time to discuss things with you all if you have any comments or questions related to this plan. And then after the plan goes for action for Regional Council in early December, it's really the rest of the time is going to be where the work starts. And some of the actions, as you've seen and know, are already underway and some are not. And so it's really going to be about tracking progress and continuing to push our community forward in as aggressively as possible to handle a problem that is not going away and arguably getting worse here every year. So without us taking aggressive action, things are just not going to get better. So with that, I'm here if you all have any questions or comments now, but then like I said, also afterwards via email or call or text, feel free to reach out regarding this item.
Thank you, TJ. Does anybody have any questions for TJ? Okay. All right. So we will go to the next agenda item with the Racial Equity Provider Toolkit. So Stephanie Crum, the HMIS Manager at Solari will give an overview of the racial equity provider toolkit and demonstrate how it is used. So Stephanie.
Hi, yes. Thank you, Madam Chair and committee for having me and having me present this toolkit. So yes, this toolkit is really a three-part toolkit. It was developed as the COC has really centered racial equity in its strategic plan. We have worked with a lot of different partners, also with Donald Whitehead and Jeff Olivet. Also the COC, lots of providers, and Solari have developed this race equity provider toolkit. So what this is there's two parts. There's the racial disparities and homelessness dashboard, and then providers at the provider level will be able to run the race equity toolkit art report. And then using both of those together, they'll be able to take a look at equity right there in their own agency. So we'll pull up the dashboard here in a minute, but one thing that we'll be able to look at as they pull up their art report is they'll be able to see clients in their agencies, reasons for their homelessness, length of stay, time of entry, time between the entry to the project and homeless move-in date. They'll be able to say rates of homeless move-in date and engagement, exit destinations, and death rates. And they'll be able to see all of this broken out by race and ethnicity. Can you flip to the next page? Thank you. So yes, the two steps to get started are when you pull up the race disparities and poverty homelessness dashboard, you're going to be able to see the percent of persons identifying as a given race in Maricopa County. And you're going to be also able to see the percent of persons living in Maricopa County broken out by race and ethnicity who are living in poverty. Some of the other data points you'll be able to see are the percent of clients experiencing homelessness in Maricopa County who are in emergency shelter, supportive housing, transitional housing, permanent housing programs, again, all broken out by race and ethnicity. We'll also be able to see clients served in both rapid rehousing programs, permanent supportive housing, and other supportive housing programs in Maricopa County as well. And then in the art report, again, we'll be able to see that same ethnicity breakdown, primary reasons for homelessness. Are you able to pull up the dashboard? Would you like me to share my screen real quick? Yeah, let me share real quick.
Craig, can you make Stephanie a co-host so that she can share her screen?
Okay. Promoted. You're good to go.
Awesome. All right. Can everybody see okay? Okay. Everybody can see? Okay. Very good. All right. So when you first pull up the dashboard, this is the page that you'll see. You'll see the same colors highlighted in the toolkit as far as the total county population, the same color for population in poverty, and then the clients who are served in these particular programs. As you scroll through the dashboard here, you're going to notice right away some pretty big disparities. You can notice right away that Black and African American folks make up less than 6% of our Maricopa County population, yet they're making up nearly 30% of our homeless population. It's a huge disparity. You can see that with a lot of the other populations as well. So you can see this. This also includes the data from the census, and we will be making the new data available once it's released on this dashboard as well. All right, and then can we flip back? Actually, let me flip back to, here we go. All right, and then some of the ways that to use this dashboard and the toolkit together is we really want folks to compare the race ethnicity makeup of the clients that are in both Maricopa County and in your programs. Are they overrepresented? Are they underrepresented? We really want people to look at the primary reasons for the homelessness of their clients. What are the trends? Do they see trends for Black, Indigenous people of color that are different compared to those of their white clients? We also want to compare the exit destinations for Black, Indigenous people of color compared to white clients. Which group has the more positive exits and where are they exiting to? these are some things that we could look at the provider level. We really want providers to look at the big picture, to be able to use this to determine health factors and outcomes for their clients, to really see what kind of measures that their agency might be strong at and what they might be able to improve and what can use some work. We really want to look at these measures disaggregated by race and ethnicity. And we want to highlight that this is a starting point. We really want to start broaden conversations about homelessness, race, ethnicity, and equity, and really draw attentions to those gaps, the gaps in the system, the gaps even right at home with our own home agencies and providers and programs. And we also want to prompt urgency and move these conversations into action. And we really do believe that this toolkit is a great way to do that. Yeah, I want to pause to see if there's any questions. The back of the toolkit also shows providers exactly where they can find the ART report in the HMIS system. So that's just the last page of the toolkit. But yes, does anybody have any questions related to how to use this toolkit or what possibilities it could have?
You may have said this, Stephanie, but where would they get the toolkit, or will it be sent out, or?
Yes, what I'd like to do as this moves through the COC and the board and gets approval, I would love to set up provider trainings to where we can have trainings for providers and anyone interested in running this toolkit. Yes, the toolkit is available right now in Service Point under ART. If anybody would like this document, I can certainly send it out, which has the instructions on exactly where to find the toolkit and also these suggestions on how to look at the data. But I really would like to, as it is approved by the COC, to move towards a system-wide training for providers.
I think that would be a great idea. This is really impressive. Thank you for all the work.
Thank you. This really, I do want to highlight, was a combined effort, between the race equity partners, COC, various subcommittees, in conjunction. We did strip our branding from this because we really want it to be a community tool, not a Solari tool. We really want providers to be empowered to look at the data at home. These are systemic issues, we know, but systemic change can take time, and these are actions that can happen right now at the provider level.
Stephanie, this is Katie. Just to add, this was sent out in your packet, so you all have access to these directions, and this is also posted on the MAG website under this committee meeting.
Does anybody have any other questions or comments?
I just have a quick question. This is Letitia from UMOM. With the ability to pull this data, is there going to be an opportunity for the community to have discussions around what the trends are and what the findings are?
I believe so, yes. The COC right now has several race equity work groups, and I believe there's a race equity leadership group as well. I would love to be a part of those groups with this toolkit, help folks really look at their data and really look at those trends and yeah, help figure that kind of stuff out. But those work groups are available. And I know that Katie can probably speak more to that.
I would just ditto what Stephanie said, and that the race equity, there's a race equity data group specifically that feeds into the data subcommittee that will be continuing to meet and dive into some of this work.
All right, well, thank you, Madam Chair, and thank you again, committee.
Thank you. Great job, thank you. I will move on to the next agenda item, the learning management system. And TJ will discuss the learning management system and ask for volunteers to join the learning management work group. So TJ?
Thanks, Madam Chair and members of the committee. Yeah, like Michelle said, this is a really exciting one for me personally. As being a member of this community, there's an opportunity for us in Maricopa County to really develop and work on a learning management system. And so what that means and looks like is a one-stop shop system that can house our trainings to really ensure that everybody in our community, specifically providers, has access to effective trainings. And so we met with a small group of folks in our community, a large provider. We met with our HMIS lead. We met with the Housing Coalition, and several others to just have the initial conversations like, is this something that we're interested in doing? And there was initial interest, and we wanted to bring that forward to you all as well as the board. The board meeting just came first, but the whole goal is to really engage with you all and to get volunteers. So here's overall the context of this. One is that Pima County has a learning management system that they are utilizing right now that houses some of their core trainings. They would like and are willing to partner with Maricopa County. We would have our own segments of this, but could also share some of our trainings, right? Because trauma-informed care, motivational interviewing, some of these things don't change based on your geographic area. Those are standardized concepts and trainings that could be offered. And so there is an opportunity not only to collaborate, but to standardize some of this training. So initially, one of the thoughts would be to just get training up there, and that's it. So like our shared housing trainings, maybe our HMIS trainings, to just make it more accessible and in one space. Later on, this could be an opportunity to really embed within policy. One thing that many of us had talked about in our community before is creating like a certificate program, where you're like an emergency shelter case manager certificate or a rapid rehousing case manager certificate that has like 40 hours worth of standard trainings of best practices that people could get. And that could be a part of your onboarding process. And we know that training takes up a lot of time and energy for each organization. So we're hoping that this could be valuable. In addition, as we just talked about race and equity, one thing that we've noticed with the data is that many of our organizations are very diverse on the front lines, but in leadership are not. So one way that we could support that is, as a part of this learning management system, really structure out professional development and leadership trainings and things to support our staff in building up the skills to grow in their organizations as supervisors and managers and directors. And so how can we not only address standardization and best practices, but also enhance the ability for frontline staff to grow into leadership positions? So as you can see, this is a really exciting opportunity. And what we want this to be is really driven by those who will be mostly impacted by it, which is you all. You all represent the providers, people doing the work. We want to make sure that there are plenty of voices for providers who want to be at that table. So this item is really just for information, which I just provided for discussion. So if you have questions or comments, please bring them up. And then lastly is to identify any of you who would like to actually volunteer for a work group to be a part of the administration of pushing this work forward. We don't, for the work group of this is not meant to be a like in perpetuity group. It is meant to really be focused on the implementation and starting of the learning management system here in Maricopa County. So that's the first part. Ty, I see you raise your hand. Did you have a comment or question you wanted to bring up?
Yeah, I just wanted to share that in the learning management system, I believe that we're really looking to also include HMIS trainings in this platform. So currently, agencies that are familiar with HMIS trainings, we kind of use a hodgepodge of SurveyMonkey and YouTube videos. We're looking to get that into the learning management system for the Continuum, in addition to those programmatic trainings. So in that regard, I'm definitely very supportive of the idea of the learning management system and would be happy to volunteer myself or Stephanie to participate in that work group.
Thank you, Ty. So any other comments or questions? And then like Ty just alluded to as well, if you are interested, please speak up, raise your hand now, and I'll add you to a distribution list, and then we'll work on scheduling our first session. We want to move pretty quickly on this. To be honest, this is a good opportunity this is one of those things that's going to be iterative and move in phases. So we're not going to go for everything right up front. We're going to get into it and start the ball rolling, and then we'll continue to progress as we go. So 2 hands up. Wendy, did you have a comment, or are you just raising that you want to be a part of the? All right, you want to be a part? All right. And then DC?
Would like to be a part of it.
Awesome. All right, so right now I have an HMIS rep, Wendy, Dolores, or DC. Anybody else who wants to be a part of this work group? Yeah, go ahead, Katie.
We have a comment from the audience. Corey, I will allow you to talk first. Do you want to take yourself off mute?
Yes, I'd like to be a part of the work group.
Sounds great.
Corey Billingsley. And then also Laura Scott Mickey, I just took you off mute.
Yes, I'd like to be on the panel too, if possible.
Thanks, Laura. And Michelle, back to you.
Michelle, would you like to be on it as well? Is that why you're raising your hand?
Yes, please. Yeah.
Okay, awesome. All right, y'all. So I have HMIS rep, Wendy, DC, Corey, Laura, and Michelle. Are there any other members of this committee who would like to be on that group? I am adding our initial group too, so there will be a member. Well, hopefully, Joan, you're on, so you can just maybe told people for me. The Housing Coalition, we're looking to do ASU Action Nexus, MAG staff, obviously, and then we had Community Bridges as a part of the initial conversation. So we're hoping to have a rep from there, as they're one of the bigger providers. Thanks, Joan. Anyone else though, before we shift off of this agenda item? All right, well, if Richard Cruz, are you raising your hand to be on that group?
Yes.
All right, thank you, sir. I will add you. And if you're hearing this and haven't raised your hand or are having technical issues or whatever, please just reach out to me afterwards. Send me an email or send me a text or a call, and we'll make sure that you get added to the group. And then committee will be sharing updates with you as time goes on of our progression here, because regardless of whether you're not on the working group or you are, this is going to hopefully impact for the good our entire continuum and our providers of homeless services. All right, with that, thank you, and back to you, Madam Chair.
Thank you, guys. So we will move to the next agenda item, number 9. Katie Gentry with the Human Service Planner with Meg will provide an update on the HandUp tool and ask for feedback, making this tool public. So Katie.
Thank you, Madam Chair. I was trying to find my unmute and I was already unmuted. So I just wanted to share with you, there's been interest in potentially making the HandUp tool not password protected and instead have the tool shared to a, essentially it would, if you're interested in learning about this, it would pop up to the HandUp tool and then it would redirect you if you're actually looking in getting services. So this is what the HandUp tool looks like currently. It's password protected, and we are interested in taking off that password protection and instead putting a pop-up that would say, like, are you in need of services? And at that point, it would redirect you to 211. But if you are not interested in services, it would direct you into HandUp, which would help you with the planning. The reason we're looking to do this is it's less administratively burdened, and it allows more planning agencies to access this all in one place. To give you kind of context, some things that we've had expressed to us is the concern that the map kind of identifies where shelters are and concern around that. And I just wanted to give kind of a comparison of where all this information is coming from. This is a data dump from 211 that MAG put together. So when you're on the 211 page and you search for shelters, all of these addresses are already publicized. And so all of the information that is within HandUp is not any different than something that you would find on 211, but we do want to gather any feedback that you have or concerns about this of making the HandUp tool public to kind of anybody and everybody. It wouldn't be largely broadcasted, but with the regional action plan going to regional council, there is interest for more cities to be using this planning tool and start to do more development around that. So I'm happy to answer any questions or hear any concerns expressed. Maggie, who is in the development of this.
Hi, Katie. Hi, members of the committee. I just wanted to note that while the majority of this does come from 211AZ, we do have HIC data as well. And then I think we received a couple additional programs via email. If you have any concerns about those locations, you can go on here, type in your provider name, look at your list, and then email us if you have any concerns about things being shown publicly. So I just wanted to make sure that was stated as well.
Randy?
Just a question about time to asset manage this for changes and updates. So for example, Cass and a bunch of providers have opened in Glendale. How quickly would that have been added to the system? And if someplace changes, how quickly is that change posted to the system?
So I can speak to that, Wendy. So we're working in partnership with 211 Arizona. So if you had registered the change with them, they could push it back out to us. It kind of depends on the urgency. We currently are planning to update this twice a year around April and October. But if there's anything more urgent, we still have that feedback button on the left side. So if you submit the change there, the email will come to us and we can work with you to make sure it reflects it immediately. The thought is that, you know, while new programs come in and old programs go out, there's usually not a ton of change, right? Which is why we settled on twice a year, but anything urgent, please let us know and we can make sure it gets reflected right away.
Awesome. Thank you.
Any other concerns with this being made public or changing from a password protection to a pop-up asking you what your needs are? All right, if nothing else, back to you, Madam Chair.
Sorry, I was muted. Are we any other comments from the committee? Okay, so we will move on to the next agenda item, which is the Continuum of Care Charter. So Katie will provide an update on the charter and the committee's roles and responsibilities. So Katie.
My apologies, I was also muted. So we just wanted to share with you that the Continuum of Care charter work group made up of the board met and wanted to give some feedback and also come back to you. I know I heard a lot of discussion about you all wanting to lead this work, be more action oriented, and really move from information and discussion to action. And we agree with you, and so does the board. And so we really want to not only kind of give an overview of overall changes in the charter, but also what the board would like you all to do as the committee and see if there are any additions that you all think should be added to your roles and responsibilities. So the first section, this meeting's monthly. We heard last year that you all felt like you could meet monthly and it used to be every other month. We reflected this language to be meeting monthly as you all have been doing that, and we always have the ability to change or cancel a meeting if a meeting is not needed. The second thing that happened was really this participation section. So across the continuum of care, many people felt that 4 consecutive absences was just too long because that was almost a quarter of meetings. And so we are lowering those absences to 3 instead of 4, as well as having a warning after 2 meetings. And then the last thing that we added was this code of conduct, which is across the board and subcommittees, is adding language that has members sign a conflict of interest statement each year. The second thing that we did was across all of the committees, add this specific representation about geographic representation, racial diversity, and underrepresented groups. So this used to be just a consideration in the membership process, but the board and many other committees and subcommittees have felt the need to make this a lot stronger. So this states that geographic representation will have at least 1 member from each area of the region. The racial diversity will have at least 1 member representing every race in the homeless response system. So that means if we have Black, Hispanic, white, Native American, and multi-race represented in the system, then there should be at least 1 member of each of those races sitting on the committee and boards. And then the last thing is underrepresentation. So the committee will select members based on proposed contribution, weighing LGBTQ+, IA+, and other underrepresented populations. So really reflecting this need to be more diverse and making it mandatory rather than just an encouragement. And then finally, under membership, we changed the language to actually reflect how you all do your membership process. So you all, we advertise out to the entire committee boards, all of our mailing lists, and we have interested parties submit an application which includes a resume, and then it is reviewed by a membership work group and brought to the committee for a vote, which is just what happened about a week ago. And we will be bringing it for a vote today. And then finally, roles and responsibilities, which I know is where you want to spend probably the majority of this time. And I can give a quick update as to what changed. So we strengthened the language about really making the community best practices something that the committee is responsible for. So the board really is interested in having you all lead this work, really drive this work home, and be responsible for the community best practices, with feedback going straight to the COC board rather than to MAG staff. The second thing that kind of throughout this, you'll see that all of your feedback is going straight to the COC board rather than to MAG staff. The next big change was number 6. So review the system performance measures and provide feedback to providers implementing best practices across the system. So the board is really interested in you all taking the responsibility of the system performance measures, reviewing those on a quarterly basis when they are produced by HMIS, and starting to implement how can we improve our no-flow score? How can we improve our system as a whole? The next one would be the system flow dashboard. So reviewing that on a continual basis and providing feedback to the data subcommittee. So this is produced monthly, and then there's a synopsis produced quarterly. So the board would like you to be involved in that review as well. And then the next one would be the evaluation tools. So all the tools that are used throughout the COC system would be evaluated by the committee, and this would be something that you all would be taking initiative in reviewing, and as well as the ESG and COC standards for administering assistance. You all are the ones who are often doing this work, and so we want your feedback to go to the ESG and up to the board as to, is this assistance working? Is it not? What changes need to be made? And then finally, this was added to all of the subcommittees and work groups, that you can create work groups that are time limited, data driven, and goal driven as you see fit, because the board wants to empower you all to really do that work and get work done as you see fit. No, that was a lot. So I will pause and see if there's any questions, feedback.
I think it's nice, and this is Michelle, I'm sorry, this is nice to see that the board to put this into action and to see that we really want to be more involved in data and decision making. So this is very encouraging.
The other thing I will say, that as staff, we are putting together an annual calendar, so it won't be that you are reviewing the evaluation tools and community best practices all in one month. It will be spread out throughout the year so that we're annually reviewing, but it's not just we're going to send you 7 documents that are all 20 pages long and ask for feedback at the same time.
This is Richard Cruz. A thought around the diversity component of the charter. So in many marginalized circles, there's a phrase that says not all skin folk is kinfolk. And what that means is that just because you look like me does not mean that you hold the ideas of the community that you may identify as. And so I think that there's an opportunity within that speaks to, it's not just about an individual, but members of that are part of like really targeting organizations that do that level of advocacy around homelessness for specific cultural and ethnic backgrounds and populations. I think there's an opportunity within that because we know then that's the work of the organization, as opposed to just looking at what are the visual diversity components of the group. Just food for thought.
Absolutely. Thanks for sharing that, Richard. And I will add that we did that with the committee recruitment. We had quite a few new applicants that and had a very diverse pool of applicants that applied because we specifically did targeted outreach to not just our listserv, for example, this time around, and we'll continue to do that moving forward.
Any other comments? Feedback?
This is Nikki Ramirez with CPLC. I just have a quick question. I wanted to see the work group that has been established to review the charter. Does that only consist of board members? Are there board and committee members? How is this being reviewed?
Madam Chair, Ms. Ramirez, the board work group or the charter work group is just board members. The board is responsible for evaluating the charter on an annual basis. And we received feedback from the committee and subcommittee chairs, and then are also reviewing this with each committee and bringing that feedback back up to the board charter work group before it goes before the board at the end of the month.
Thank you.
Any other questions or feedback before we move on to the next agenda item? Okay, we're lucky we get Katie again. So she on agenda item 11, the committee co-chairs. So Katie will provide an update on the committee co-chairs. So Katie.
Yes, thank you, Madam Chair. I think I have your remaining agenda items. We did receive interest from 2 individuals in expressing committee interest in the co-chair position. So wanted to bring them forward to the committee for review and ask you all a question, I guess is the best way. We received applications from Miss Wendy Johnson, and then we also received an application from Mr. Cruz that was after the deadline, and want to throw it out to you all. You do need to vote on this and elect your co-chairs and take action on this item. And so would you like to accept after the deadline application? Do you feel comfortable with that? And then are you interested in electing chairs? Ms. Johnson.
I'm sort of disappointed that more people aren't involved in wanting to work in this role. You know, I'm hoping, you know, if someone is interested, then I think we should extend the deadline temporarily to allow Richard's application and others to get in and be reviewed. I don't think it should go to the lowest common denominator, meaning I'm the only one who applied in time, which was barely myself. If people are comfortable with that, that's fine, but I think we need 2 co-chairs, and I would like to see some diversity in those chairs. That's my 411.
So Katie, so I just have to ask for a motion to see if we can approve both of the co-chairs.
Yes, I believe that would be the next step.
Okay. All right. So can I have a motion to approve Wendy? I think I'll do it twice and do each co-chair separately, if that's okay. So can I have a motion to approve Wendy Johnson as a new co-chair? And then Katie will do, or do we have a motion?
This is DC. Sorry, this is DC. I move that motion.
Okay. And do I have a second?
Second, Richard Cruz.
Okay, thank you. So Katie, would you please do a roll call stating yay or nay on how you vote?
Vanessa Carta,
Yay.
Aaron Cohen-Haig, Richard Cruz,
Yay.
Kathy Denolfi,
Yay.
DC Ernst,
Yay.
Letitia Gambino, Michelle Jameson.
Yay.
Wendy, I'm skipping you as you cannot vote. Anne Marie Johnston.
Yay.
Christina Lopez. Christina, you're still on mute. Welcome back to you, Laura Magruder.
Yay.
Jennifer Page.
Yay.
Nikki Ramirez.
Yay.
Ty Rosensteel.
Yes.
Sarah Sims.
Yes.
Lynn Spillers.
Yay.
And Craig Tripton. All right, and Christina, I see your technical difficulties and a yes from you. All right, the motion passes.
Okay, so congratulations, Wendy. Now I would like to have a motion for Richard Cruz as a co-chair.
DC, I move that motion. Sorry, Richard, go ahead.
I was going to say, before the motion is raised, I do want to at least have us have conversation on what Madam Chair-elect raised when it comes to leadership by default. And so, yes, I did submit it after the deadline, but just really giving thought. I mean, I'm down either way, but really giving thought around is there anyone else that is also interested? Because at that point, we are now operating beyond protocol. And do we need to give additional time for any additional applicants or anything of that nature? Just because, like I said, we're moving into a space of leadership by default. Because we're deciding based on the only 2 people who applied.
This is DC Ernst. Can I speak for a minute on that? So while I appreciate Wendy and Richard's comments, personally, I think that I had plenty of time to think about it based on being notified of the opportunity to apply. And I think that the fact that both of you applied, I don't think that's default. I think that you guys showed interest and initiative to apply. So I appreciate you guys stepping up to take the leadership on this. And that's, thank you.
I had one question. This is Jennifer Page. The application process required the interested parties to submit a letter of interest in a resume. who reviews those, who has access to that information? Because that's not something, I don't think that was included right in the packets.
That is correct. Madam Chair, who I think we lost in Ms. Page, that only comes to MAG staff. We do not release it in the packet as then it is kind of given out to everybody. If members of the same way that we do not release committee applications to everybody, it just goes to the membership work group. So if somebody is interested in those letters of intent on the committee, I am happy to send those out to you on an individual basis. I think we lost our chair. Are there other questions or thoughts on this topic?
Katie, this is
Laura
Wendy
Magruder.
Johnson. Oops, we both spoke.
Let's start with Wendy and then Laura, I'll come to you after.
Okay.
I think the last 24 months have taught us a lot about our need for more engagement, more action, all that kind of stuff. I am hoping that as the funding comes in, that we have the support of the government agencies to fund these things, that we will see the Continuum of Care Committee be much more influential, and more people will want to unseat current leadership or elected leadership with a different person. And so I look forward to this being a new generation for this committee, that it is, you're some of the smartest people out there doing the work we do. And while you may not aspire to committee chairperson, don't think that you're not going to get involved, because we are the only people that can make change at the level we're at. So Laura, go ahead. I just wanted to say that I just think there will be a day when you have too many applicants and we have to have a committee chair, co-chairs committee. So anyway, I just wanted to share that's my hope.
No, and I was just going to say, I completely concur with DC that, you guys took the initiative. It is a time commitment. I appreciate that. And I don't see any reason to not move forward with accepting Richard's application and making a motion to move forward on a vote.
If I can add one more thing, sorry, this is DC, towards Wendy's point of hoping that others engage in the future to participate in the leadership role. Maybe a consideration would be developing a mentorship within this committee to engage those who have not historically had leadership roles, to be able to be mentored into them, so that they feel comfortable maybe in the future applying for the positions as well.
Hi, this is Michelle. I'm back. I'm sorry about that. I think that's a great idea to develop the mentorship role.
And I see this existing in that frame as well, should I be elected, as while I have a deep wealth of experience in facilitation and convening and leading, and when it comes to being specifically in the homelessness space, this particular position as director of programs at Human Services Campus, like that's my first deep intentional work in that space, in this space, specifically focusing on that. And so having someone like Wendy who is well seasoned in this work, I see as an opportunity for mentorship in that way. And so I think that even the notion, like if this were to be, as we move forward, I see this as like an initial entree into that space.
Thank you. And I apologize, my computer failed on me, but do we want to go forward? Because I missed some of the discussions, I do apologize, and go forward and have a motion for Richard Cruz to go forward as a chair, co-chair?
I would put forward the motion that we accept Richard's intent to serve as co-chair be accepted.
Okay.
And I'll second.
And who is
Laura
that?
Magruder.
Okay, thank you, Laura.
Sure.
Okay. And so Katie, would you proceed with roll call?
Oh, yes, y'all are so quick. Okay, Vanessa Cardell.
Aye.
Thank you. Richard, I'm skipping you because you cannot vote. Kathy Denolfi.
Aye.
DC Ernst.
Aye.
Letitia Gambino. Michelle Jameson.
Aye.
Wendy Johnson.
Aye.
Anne-Marie Johnston.
Aye.
Christina Lopez. Yes, on her end. Laura Magruder.
Aye.
Jennifer Page.
Aye.
Nikki Ramirez.
Aye.
Tyler Evansteel.
Yes.
Sarah Sims.
Aye.
Lynn Spillers.
Aye.
Craig Tripkin. Right, did I miss anyone? The motion passes unanimously.
Great. Well, thank you and congratulations, Richard, and both to Kathy. You guys will be both great in that role. So thank you for stepping up into the leadership role and congratulations. And so now, yes. All right, we will move to the next agenda item. We really get a lot of Katie today. So she's going to talk about the committee membership, and a special thank you to Chayla, Letitia, Jennifer, and Wendy. Oh, it was Wendy. Sorry, Wendy. I got your name for some reason. The last one, so I apologize. Who sat on the committee membership work group? Katie?
All right, yeah, back to me. Thanks, Michelle. I also cannot echo enough. The membership work group spent quite a bit of time reviewing applications because we had such a wide, diverse group of applications and stakeholders who applied. And we are bringing forward 10 individuals to recommend for membership. Members were evaluated based off of what they were going to bring to the table, their experience around homelessness and the continuum of care, how they are addressing racial equity, and what the diversity of the membership currently and how we can continue to diversify in the future. So these members include Don Bogart with Homeless Youth Connection, Melody Boyer with the Phoenix VA, Sylvia Chavez with the Department of Education, Allison Cook Davis with ASU's Morrison Institute for Public Policy, Jessica Cruz with Housing Authority of Maricopa County, Marcy McFarland with Home Inc., Jim McPherson with Phoenix Community Alliance, Laura Scott Nickey with Salvation Army, Michelle Stokes with Behold Charities, and Jocelyn Wilkinson with the Department of Veteran Services. And we not only let them know, but also let every applicant who was not accepted, let them know and encourage them to get involved with other subcommittees and work groups as part of the continuum of care and continuing to be involved. And so we are connecting them with other opportunities. So I will turn it back to your chair to ask questions.
Sorry, I had it on mute. So, okay, does anybody have any comments or questions? Okay.
I would,
Wendy,
sorry. I would just like to add that we agreed as we were going through these that many of the folks that we didn't accept were would have been great ads. They just didn't have enough COC experience or answer a question about how they would work with the COC in a way that told us they understood what the COC did. So Katie is going to reach out to those folks and let them know we would like them to engage on a committee level so that they could, going to Richard's mentorship, get them on a committee level and bring them in so that we can really start developing the COC earlier than at the last minute. You know, nominating someone will be getting people of interest and engagement. So I was really impressed with what the other team members, the other COC committee members brought to that. I learned a lot during it. So I really appreciate Katie allowing me to be in on it.
Thank you. Do any other comments or questions? Okay, could I have a motion to approve the new members onto the committee?
This is DC. I move that motion.
Okay, thank you. Do I have a second?
Kathy, I'll second.
Thank you. Katie, do you want to take, or is there a discussion on the motion? Okay, so Katie, I will now ask Katie to proceed with roll call. Yay or nay, please. So yay if you're for and nay if you're against.
Vanessa Cardell. Vanessa, you are on mute.
Sorry about that. Yay.
No. Awesome, thank you. Richard Cruz.
Yay.
Kathy Denolfi.
Yay.
DC Ernst.
Yay.
I don't have Tish's on. Okay. Chair Jameson.
Yay.
Chair Miss Johnson. Wendy Johnson.
Yay.
Sorry, I'm all over the place. Anne Marie Johnston.
Yay.
Christina Lopez. Yes. Okay. Laura Magruder.
Yay.
Jennifer Page.
Yay.
Nikki Ramirez.
Yay.
Ty Rosenstiel.
Yay.
Sheila. Oh no, Sarah Sims.
Yay.
Lynn Spillers.
Yay.
The motion passes unanimously. Back to you, Chair.
Okay, thank you. Congratulations to all the members. Any additional comments? If not, we will move to the next agenda item. Okay, so the next one is the request for future agenda items. Do any community members have any action or discussion items for future meetings? Okay, we'll move to the, if I hear none, we'll move to the next agenda item, which is comments from the committee. So for this agenda, yes.
Sorry, I clicked too late. Are we going to be doing a point in time count in January? If so, it should be on the agenda next month, I think.
Okay.
Thank you.
Madam Chair, Ms. Johnson, we will add that. I don't know what is the correct timing of this, but Celestia from the audience asked, when does the committee membership open to apply since it closed October 29th? And to answer your question, it was opened October 13th, right after the committee meeting last month. So it was available for 2.5 weeks. Sorry. Chair James,
thank you.
Back to you.
Thank you. I'm on my phone, so I've not seen a lot of the comments, so thank you. So we will add the point in time for a discussion for next meeting. And are there any other comments from the, or any comments from the committee that have any announcements or events you'd like to highlight? Okay. If I hear none, I guess just on my behalf, we're a veteran organization and Veterans Day is tomorrow. So just to point out that to support your veterans, and with nothing else, thank you. And the meeting is now adjourned.
Thank you, Michelle.
Yeah, thank you.
Thanks, Katie.
Take care.
Thank you. Take care.
Thank you.